So so growing up, I worked at a veterinary practice I started when I was probably like a sophomore in high school, and I worked all the way through high school. And then when I went to college, I knew I wanted to be a veterinarian. I worked through college at the same veterinary practice, and by the time that I got to like my second year of vet school, the vet that I worked for, when I came back home to work for the summer, was like, we don't have a job for you. And I was like, what? And so he basically had gotten me a job with a buddy of his who was a referral surgeon here in the Houston area. So I ended up working there for a summer, and after that I was convinced I was going to be a surgeon. So I went, as I finished veterinary school, I knew after having that experience, I knew that I wanted to specialize. So when I went into my fourth year, got into clinics, I still wanted to do surgery, but I was very open to the different specialties. And so my first rotation was surgery, and it was orthopedics. I liked orthopedics, but then my second rotation was medicine, and I was like, I don't know. At the end of my fourth year, I was very undecided. I still knew I was likely going to specialize. I just wasn't sure exactly in what specialty. So it wasn't until my internship, my first rotation was oncology, and I just fell in love with the specialty. And I think at the end of the day, it was the only specialty that I could work a 15-hour, 18-hour day, and I could come back and I could read about leukemia and be wide awake and just as fascinated. So I think it's the biology, kind of the molecular biology I can't. This thing that probably sets veterinary medicine apart from human medicine is we're using all human drugs. I think the biggest thing that I try to impress upon clients is that the doses we use are generally going to be lower on a body surface area. So although they're the same drugs, the severity of the side effects isn't going to be as severe as what we're going to see on the veterinary side comparatively to that of people, and that's going to minimize the amount of side effects. So not to say that there aren't side effects, but I think that when I look at my patients, a big thing is going to be quality of life. We want quality of life to be very favorable during treatment regardless. I'm a big believer in I don't want the treatment to be worse than the disease. So I think we have to take that into account, and really when I'm thinking about kind of treatment options for these guys, that's really, really important, is that I want to maintain quality of life as best we can. So I think that just, kind of talking to owners about why we see certain side effects and then what we do to sort of combat those, because there's definitely strategies to, minimizing the amount of side effects. And in general, I would say the chemotherapy experience is a much different experience than it is on the human side. Yeah, so with chemotherapy, if you think about the classic, cytotoxic chemotherapies that are administered, generally what you're doing is you're targeting rapidly dividing cells. So you're going to focus on rapidly dividing cells that are going to be, not only the cancer cells, because really cancer is just, a cell that, it's just a rogue cell that's basically just gone haywire. So the normal checks and balances that body that normally would hold that cell in check are bypassed for whatever reason. So the chemo is really targeting these rapidly dividing cells, which is why you're going to see side effects in certain places in the body. So the big three for me that we see in general with chemotherapy is going to be gastrointestinal side effects, bone marrow side effects, and then hair loss or alopecia. So to me, with bone marrow, the cells in the bone marrow are going to be turning over pretty quickly, which is why we see low white cell counts, and it's a big problem in humans based on the doses that they use. We can see it in veterinary medicine, but we don't oftentimes see it to the degree in people. With regards to the GI side effects, that's probably the number one thing we see with chemotherapy and our companion animals. So for me, the big thing is going to be, what can we do to reduce the amount of gastrointestinal side effects? So, there's great antiemetics these days that help to prevent nausea or to help out with, the vomiting that you can see with chemotherapy. Great antidiarrheals, and I'm a big fan of being proactive, getting meds on board ahead of time, because I think that reduces a lot of the nausea and things before it happens. And then the last side effect is going to be hair loss. So alopecia, again, most of our companion animals, we don't see that they lose hair. There's a few breeds in dogs that have continuously growing hair coats, like the Old English sheepdogs, the classic example, that they will lose a significant amount of hair. But for the most part, they don't lose their base coats. So like if we shave for catheter placement or shave for an ultrasound, that hair will take a while to grow back, but they don't lose their base coat. So they typically, hair loss is going to be more of a cosmetic thing. So those are kind of the big three, typically GI, bone marrow, and hair loss are the biggies. Yeah, so immunotherapy is a really kind of a cool new topic in the veterinary realm, and we've had some vaccines that have been available for a while. I think probably the one that we use clinically that's been around, since probably 2000. I used it as a resident starting probably back in 2000. That is the canine melanoma vaccine. The melanoma vaccine, for me, I like it a lot, and I absolutely recommend it for malignant melanomas, because I feel like most of our cases, whether it's oral, digit, malignant skin melanomas, I feel like you have to have something in addition to local therapy, whether local therapy being surgery and radiation. I feel like you need that other component to try to keep things from metastasizing. And in my hands, vaccine is as good as anything else we have. So I'm a big fan, not only for the potential efficacy, but the toxicity profile is so favorable. I mean, it's the way that the vaccine is administered. It's administered with a intradermal device. It's basically a single injection given once every other week. For the initial series is 4 injections, and then boosters are given at 6-month intervals. So to me, the most favorable or the best part about it is just the toxicity profile is so low. So for me, it's a win-win for the patients, and it's very easy to administer the vaccines without a lot of side effects. So the same concept that's used for the melanoma vaccine, we do have a lymphoma vaccine for B-cell, large cell lymphomas that I use and I do like. I feel like that we anything we can do to try to solidify a remission for chemotherapy. So sort of the same concepts, the plasmid vector that's used as the delivery for the melanoma vaccine is the same vehicle to use for the lymphoma. We're just targeting murine CD20, which is a B-cell marker. So I like that. I use it for a lot of my B-cell lymphomas to help out with remission. So I do like it. Again, pretty low toxicity profile, which is great. And then the other vaccine that we just finished up a clinical trial here at the beginning of the year is with the osteosarcoma vaccine, Aratana. We did an extended phase 1 clinical trial here. It's basically the listeria-based vaccine that was developed at the University of Pennsylvania for the adjunct treatment for osteosarcoma. So the concept for the appendiculars is still the same. We're basically still considering amputation followed by chemotherapy, and then we're using the osteosarcoma vaccine after that. So the preliminary data on the osteosarcoma vaccine is very good. Dr. Mason reported some pretty significant improvements in survival times. The company Aratana, who has got the rights to the vaccine, is now compiling the data for the phase 1 study, but I think there's a lot of real promise with that vaccine, and now we're all just kind of waiting to see how survival data and those types of things once we get it in a larger clinical setting. But yeah, I think immunotherapy is a very exciting time because we have things now that we didn't have even 5 years ago to be able to offer for clients. So it's just another tool in the toolkit.